All right, so we're going to be taking demonstration on thyroid examination. Okay, so always examine patients with the neck swelling sitting up. It's important to remember that. Always examine your patients with the neck swelling sitting up. So remember to grip our patients, to greet, create rapport, introduce yourself, and ask for permission. Okay, so good afternoon, Mr. Desmond.
Good afternoon.
My name is Dr. Kachi. I want to examine your neck. Okay, can I go ahead?
Okay.
Thank you very much. Okay, so first thing, you stand in front of the patient and inspect the neck. Okay, so by inspecting, we want to check if we want to check for the obvious size of the neck mass. We want to check, just inspect, look at the neck, whatever you can see. What is the size of the neck mass? How many neck masses are there? Is it a single mass? Are there multiple masses? You want to know the size of the neck mass. Is it in the midline? Is it a lateral? So you want to know all those things by inspecting. Okay, you want to know if it's a draining sinus on the mass. Okay, so you look at the mass and spend some time, stoop low at the level of the mass, and make sure that your examiner sees you trying to look for findings on inspection on the neck mass. Okay, so can you raise your head up a little? Okay. Okay, so after your inspection, you try and check for other things in front before you go behind and examine. Okay, so we want to check for differential warmth. Okay, we want to check for tracheal centrality. We want to check if the mass is tender, and we want to check for tethering, if the skin overlying the mass is attached to the mass. Okay, then we'll ask the patient to swallow and to bring out the tongue. Okay, I will take that again. We want to check for differential warmth. We want to check for tenderness. We want to check for tracheal centrality. We want to check for tethering, if the skin is attached to the mass. I want to ask the patient to swallow and protrude the tongue, so we can be able to distinguish between a thyroglossal cyst and a thyroid mass, a goiter. Okay, so after inspecting, I want to check for differential warmth. So normal, abnormal, normal. Okay, for tenderness, I take one of my fingers, my index finger, and try to depress while looking at the patient's face. Okay, then for tracheal centrality, if the mass is big, it may be difficult to fully examine the patient with your ring, middle, and index finger. Okay, so you may want to stabilize the patient and use one hand, run down. Okay, so try and press deeply. See if the trachea is still central or if it has been displaced by the mass. Okay, so after checking for tracheal centrality, we want to check for attachment. So we'll pinch the skin directly above the mass. So if the skin can be pulled up, then it is not tethered. Skin is not attached to the underlying mass. Okay, then finally you ask the patient to swallow. Mr. Please swallow. Okay, thank you. Then we'll ask to protrude the tongue with the following instructions. Please, sir, open your mouth. Bring out your tongue. Okay, take it back in. Thank you very much. So, having done this, we'll move to the back of the patient and continue our examination. Okay. While behind the patient, we want to properly position our hands to aid in our examination. Okay, so our two thumbs, right and left thumb, will be directly on the occiput. The two index fingers will be directly underneath the jaw, so that it can help us in moving the neck forward, backwards, left and right. Okay, then while our other fingers will be used to examine the mass. Okay, so first of all, we start our examination from the back with examining for the cervical lymph nodes. Okay, so we'll start with the submental, submandibular. You should be seen to be rubbing against the bony prominence, under the angle of the mouth under the angle of the mandible for submandibular, right? Then preauricular, anterior cervical, supraclavicular, okay, posterior auricular, and occipital. Okay, so having examined for the lymph nodes, we then move to check for eye signs. Okay, we can check for proptosis from this point. All other eye signs will examine from the front. All right, so while positioning our fingers, we'll tilt the patient's head posteriorly slightly until we can see the eyebrows. So we find out if the eyeball is visible above the level of the eyebrow. If it is, then the patient has proptosis. All right. If not, then the patient doesn't have proptosis. All right. While behind the patient, okay, you also want to palpate for the internal carotid arteries. All right. So while you're palpating for internal carotid arteries, you must palpate for the internal carotid arteries one at a time. Okay. So while you're palpating for the right, make sure that your left hand is directly on the head of the patient. Okay. So your examiner sees that you are not palpating with the other hand. So like this, and we'll palpate for the internal carotid on this side, okay, and change the position of the hand and palpate for the internal carotid on this other side, okay. So if we cannot feel the internal carotid, then Berry sign is said to be positive, okay. So after that, we'll move to the front of the patient and continue our examination. You should also put your other hand not in use on the head of the patient to also stabilize the head of the patient while you use your other hands to give instructions to the patient, okay? So, Mr. Desmond, please can you follow my fingers, okay? Go up. Okay? So we're trying to check out for lead lag and lead retraction, okay? Also, we'll also do the Hitch test. Follow my finger. Okay, so we want to check out for the extraocular muscles. You know, are there any of the extraocular muscles that are affected? We want to find out, okay, by doing the Hitch test. We test for the abducens, the external oblique, internal oblique, and all other extraocular muscles, okay? So after that, we want to find out if the patient is tremulous, if there's tremor. So ask the patient, please can you stretch out your hands, okay? And observe if we can find tremors. And if we can find tremors, we'll find out what kind of tremors are we seeing. Are they intention tremors? Are they fine tremors? Okay, so after that, bring down your hand, thank you. We want to check during a brief cardiovascular examination. So we check the pulse rate and rhythm. Then we check the blood pressure. After the blood pressure, we get the heart rate, okay? It's very important to run a quick cardiovascular examination, as a thyroid mass as a goiter can have cardiovascular complications. So it's important to have a cardiovascular examination while running your examination for thyroid masses. Okay. Next up, we want to check for pretibial myxedema. So examine the lower limbs. Okay. Okay. So we look at the legs. Look at the legs. See if there's obvious shiny. If it's shiny, okay. And we'll check if there's edema. Usually, pretibial myxedema is usually non-pitting, okay. So you should be seen to be palpating along the medial border of the tibia, along the medial border of the legs, okay. So after that, you ask the patient to take a walk. All right. We're trying to look out for proximal myopathy, so you ask the patient to take a walk. All right, so Mr. Desmond, please, can you take a walk? You want to observe the patient's gait. All right. So each patient can take a walk. The power is full. Each patient cannot take a walk. You have to grade the power on the limbs, on all the limbs, okay? So that's how you can quickly do a thyroid examination.